Welcome to our OET writing evaluation video. Today, we will evaluate a candidate's response to an OET writing task based on a given case note. We will assess the response using the OET writing criteria: purpose, content, conciseness and clarity, genre and style, organization and layout, and language. A few things to note before we dive right in. Pause the video as needed. Read and understand the case notes. Read and understand the candidate's attempt. Attempt a writing using the case notes given here, so you can evaluate it yourself. Let's begin by reviewing the case notes and the candidate's letter. Here are the case notes for our task. The patient, Mrs. Florence Arthur, is a 38-year-old woman admitted with severe back pain, fever, and vomiting. She has a history of renal stones and cystitis. Recent investigations indicate severe bilateral hydronephrosis and urinary sepsis. The writing task requires us to write a letter to Ms. Nadia Schroeder, the head nurse of the urology department, explaining the patient's condition and the need for bilateral nephrostomy tubes. Now, let's look at the candidate's response. The letter is intended to inform Ms. Schroeder about Mrs. Arthur's condition and highlight the urgency of her treatment. The evaluation. First, let's evaluate the purpose. The purpose of the document is not immediately apparent and has very limited expansion. The letter mentions introducing Mrs. Arthur and her symptoms, but does not clearly state the urgency or primary purpose of the communication upfront. The candidate's letter scores a 1 in this criterion. Next, let's examine the content. The content is mostly appropriate but lacks emphasis on the urgency of the patient's condition. The letter should clearly connect the elevated white cell count and CRP levels to the need for immediate intervention. It should also summarize the immediate steps needed, including the recommended antibiotics and the importance of starting intravenous fluids. There are also inaccuracies in the letter which can be misinterpreted. The candidate's letter scores a 3 in this criterion. Conciseness and clarity. The document exceeds the required length of 200 words and includes lengthy, convoluted sentences that lack clarity. Irrelevant information, such as detailed past medical history, detracts from the primary message. Simplifying the sentences and focusing on the critical information will enhance clarity. The candidate's letter scores a 3 in this criterion. Genre and style. The writing is clinical and factual, appropriate to the genre and reader. Technical language and abbreviations are used correctly. However, CRP should be spelled out when first mentioned. C-reactive protein, CRP. The candidate's letter scores a 7 in this criterion. the highest score. Organization and layout. The letter contains lengthy paragraphs that combine multiple pieces of information without clear segmentation, making it hard for the reader to follow. Breaking down the information into clear, concise paragraphs will improve readability. The candidate's letter scores a 4 in this criterion. The final criterion, language. Here are common punctuational, spelling, and grammatical errors evident in the letter. The letter also contains inaccuracies, ambiguities, and redundant elements that strain the reader. Correcting these errors will improve comprehension. The candidate's letter scores a 5 in this criterion. We hope this evaluation helps you in your preparation for the OET writing test. Thank you for watching.